All right, it is time now for our interview segment, and our guest is already in studio, Mr. Joseph Magero, who is the chairman of Kenya's campaign for safer alternatives, or if you like, CASA. And he's here to tell us about the organization and what they do. Good afternoon, and thank you for joining us.
Thank you very much for having me.
All right, let's delve right into this conversation. Right. What is this organization about from the onset?
Okay, well, Campaign for Safer Alternatives is an organization that assists smokers to quit smoking cigarettes. Mm-hmm. Those who can quit using products such as nicotine gum, which are WHO recommended, can do so. And those who can't, we advise them to pick up on other products that are coming up in the market.
Okay.
Right.
So, generally, what is the difference between, I've seen e-cigarettes and these nicotine products, difference between traditional cigarettes? Is there a difference?
There's a huge difference. Both products contain nicotine, but one product does not contain tobacco. Now, when it comes to smoking cigarettes, it's the burning that releases tar, and that is what causes cancer. But nicotine itself does not cause cancer. It is not carcinogenic. So you have products like electronic cigarettes and oral nicotine products that offer the smoker the same sensation but minus majority of the harm.
Okay.
Yeah.
I was going to ask you what are the advantages, but I guess you've just said that.
Right.
It offers you the same sensation but
Yes.
without the harm.
Yes.
Now, talking about harm,
Right.
we have farmers that are into this tobacco farming.
Right.
And then we have manufacturers, and then we have the consumers.
Right.
And there is a tax increase for tobacco. I can see 10% increase in the tobacco tax. How is that going to affect every one of these groups?
Well, my focus is not on the tobacco industry or the farmers. My main focus is on the consumer.
Yes.
So if you overtax this product, you leave them no option but to remain smoking cigarettes. You must understand that products that help smokers quit here in Kenya are very expensive. We don't have cessation services. And a lot of smokers in Kenya don't want to quit. And that's just the honest truth.
Okay.
So availing products that are safer for them should be the main target for government. If you overtax them, then you leave them with no option but to keep smoking. Yeah.
Okay. So you're just offering an alternative?
Yes.
Okay.
Yes.
Not trying to make people stop. It's reducing the harm.
Absolutely. You work your way to quitting. Yeah.
Okay. So what is the balance? That's what I was looking for you to answer. Increasing the tax, does that dissuade any one of these people?
Well, what that does, it will drive the product into the black market. And now you begin to have illicit products being sold that are not regulated. And some of those could be risky for the smoker.
Okay.
So you'd rather regulate them accordingly and make them affordable and then standardize them. That way you can regulate and know what somebody is using rather than not being aware of what's happening in the underground. Right.
So how effective are these e-cigarettes?
Public Health England states that the product is 95% safer than cigarettes. The FDA, for example, in America has authorized the products to be sold in the country as safer nicotine products. A country like England, if you go to hospital and you have a problem with smoking, they offer you electronic cigarettes for free because they understand that nicotine is not the enemy when it comes to smoking, but it's the tar that is released. That's what harms the human body. Right.
Okay. So your organization, what is your agenda? What are you pushing exactly?
We're pushing for favorable laws. Also, we're doing awareness campaigns with policymakers to make them aware that other countries across the world are using these products, and we should begin to look at them, and those products can help a lot of smokers like myself, for example. I quit smoking using similar products, so I know what I'm talking about. Yeah.
What are some of your challenges in this bid?
Well, I mean, we play sort of like a devil's advocate because it's a very complicated field. And me echoing scientific evidence, sometimes we get attacked and they say that we are aligning ourselves with the industry, but really we're just for the consumer. Right.
Okay, so these tax proposals, how do you think it's going to affect the bottom line of tobacco companies in the market?
I can't speak for the industry again, like I've said. I don't represent the industry. Our main focus is for the consumer and then for the government policies. If you overtax these products, then you will make them less available in the market. That will do two things. It will mean that the number of smokers will continue to grow, as it's happening in Kenya. We have more than 3.5 million smokers, and 8,000 of them die every year from smoking-related diseases. So if you overtax these products, then you leave them with no option. Majority of us cannot afford even to buy nicotine gum or nicotine patches. Those are very expensive for the common mwananchi. Right.
Okay, so I was going to ask you, how affordable are these e-products or e-cigarettes in comparison to what we have in the market statistically?
Okay, in other countries that are using these products, they make them at least almost the same in terms of cost. So that way, if somebody is going to reach out for a cigarette, they'd rather reach out for this other product because it will give them the same sensation, but it's not as harmful to them as a cigarette. So the prices should be competitive.
Okay, right. Fair enough. So you've been in this organization, or you've been involved in tobacco harm reduction policies across the continent.
Right.
In the last, it says, close to a decade.
Right.
How far have you come? What have you achieved this far, even as you look forward to what you're going to be doing?
Well, we are growing. Right now we are a 9-member organization from 9 different countries, and we are really pushing to spread awareness. And as you can see, it's catching on slowly. Right.
Okay. So apart from awareness, is there anything else you do? Like I see here, create smoke-free environments.
Those are just advocacy efforts we're pushing.
Okay, what kind of efforts are you pushing?
We're pushing for, first of all, for legislators and policymakers to understand the difference between nicotine and tobacco and not put them in the same basket. We also are pushing for awareness. I believe smokers have rights. Just because they smoke does not forfeit their right to health. We also push for their rights. And what else do? We hold conferences in different countries every year. Yeah.
So what can we expect as we finish, finally? What can we expect going forward?
From me or from the government?
What pushing this organization.
Yeah, what we'd like to see, first of all, is for the Ministry of Health to understand the difference in these products and not put them all together and term them as tobacco products, because they contain no tobacco. Some of them contain nicotine, some do not. Right. Okay.
Thank you so much for coming on. All right. That is the chairman of Kenya's Campaign for Safer Alternatives, CASA. That's Joseph Magero, and we're talking about taxation of tobacco. And he really wanted us to understand the difference between e-cigarettes and the traditional cigarettes. He's more concerned about the consumers and reducing the health risk. Thank you so much, Mr. Magero.
Thank you.